Hello, my name is Juan Ramirez from Nightingale College, BSN 246, Section 1. Today I'm going to be inserting an IV and discontinuing an IV. Hello, Mr. Smith. The doctor ordered some fluids, so I'm going to go ahead and put an IV. Is that okay? Okay. What's your full name? John Smith, okay. What's your birthday? Okay, correct. What city are you in? Right. Where are we at? Yes, that's correct. I'm going to perform hand hygiene. Wash my hands. Okay. And I have collected all my supplies. So I got all my supplies ready. Okay. I'm going to go ahead and put some gloves on. And I am working on a sterile field, so everything is clean. Okay. I'm going to go ahead and get all my supplies ready. Okay. And I'm going to go ahead and connect my lure lock with the flush. Get it ready. Make sure there's no air. Okay. I'm going to go ahead and flush some. Make sure it's ready to go and all the air is out. So that's good right there. It's already flush. I'm going to move it to the side. I'm going to go ahead and connect my tourniquet using a banana. And I want to place it 4 to 6 inches above my incision that I want to use. I'm going to check the pulse, make sure that the tourniquet is not too strong, that I can still feel the pulse. So that's right. Okay, that's good. And I'm going to go ahead and clean the area that I'm going to put the IV using iodine. Since I'm using iodine, I want to do it in a circle motion, and I want to do it outwards when I'm cleaning, okay? So I'm going to go ahead and do outwards. So I'm cleaning the area, making sure it's disinfected, everything. I'm going to let that dry out. And I'm going to go ahead and anchor the position I want to put the catheter. So using my thumb, I'm going to kind of pull the skin a little bit down, okay? And I'm going to be using the catheter. Okay. So I want to go ahead and position it in the right position and go ahead and puncture. All right, and I get blood return. So I'm going to start advancing the catheter and loosening the stylet. So doing it like this. And I'm going to keep advancing the catheter. And I'm going to go ahead and retract the stylet, okay? I'm going to put it in my sharp container. Now I'm going to go ahead and undo my tourniquet. Undo it. And quickly, I'm going to go ahead and connect the stir lock to the hub. Okay, so that's connected. I'm going to go ahead and aspirate. Good. And flush. Okay, doing good. Now I'm going to go ahead and clamp the tubing. And disconnect the flush. Okay. I'm going to go ahead and put the sterile dressing on. Okay. Go ahead and remove. I'm gonna get the tubing and glue it on the side using some tape. I'm gonna go ahead and secure it. Okay, so let's go ahead and secure. Okay, and I'm gonna go ahead and label it. So today's date is gonna be 10/5, 1400. The size that I use is gonna be 18, and then my initials right there. And that is how you place a catheter IV. Now I'm gonna go ahead and discharge of all my supplies. So I'm gonna go ahead and throw everything that I don't need. So I threw it in the garbage. Okay, I'm gonna go ahead and dispose of my gloves and perform hand hygiene. Okay, and that's how you do it. Now I'm gonna go ahead and discontinue the IV. Okay, Mr. Smith, we're done with the fluid, so we're gonna go ahead and take out the IV. Is that okay? Okay. So I'm gonna go ahead and wash my hands. And I'm gonna go ahead and put gloves on again. Okay. So I'm gonna start by removing the dressing. And make sure you're securing that the catheter is in place. Make sure that's secure. Okay. So now I remove that. Now I'm gonna remove the tape that I placed. I'm gonna keep removing it. Okay, so that's removed. Now I'm gonna use a clean gauze and place it on top. And slowly I'm gonna remove the catheter. And I'm gonna hold this for 30 seconds so it stops the bleeding. So I'm gonna look at the catheter, look at the tip, look at the length, make sure everything's okay, nothing's abnormal, and it looks in good condition, okay? So now I'm gonna get a sterile gauze, place it on top. I'm gonna secure it with a piece of tape. Okay, so I secure with the piece of tape. It's nice and secure. Now I'm gonna get this catheter and put it in my sharp container also. Now I'm gonna get all my garbage and I'm gonna go ahead and dispose of this. Okay, so put it away. Now I got my gloves, so I'm gonna also take those off. Dispose of that. I'm gonna go ahead and wash my hands. Nice and clean. And that's how you discontinue an IV.